Okay. Well, welcome to Better Breathers Club. I'm Angie Anderson. I'm the program coordinator for respiratory disease here at Sarasota Memorial. And we have Bob Sobkowiak and Jane Rubinov. They are respiratory therapists with Breathe Strong, and they're going to be presenting on coping with respiratory disease. And I will let them take it from here, and then we'll do the presentation, and then we'll come back for questions and sharing. So welcome, guys. Thanks for coming and presenting.
Great. I'd like to first of all introduce Jane. Jane's a registered respiratory therapist and asthma educator, very experienced educator and clinician. She does a lot of education for patients with different devices in terms of airway clearance devices and other devices. And she's also an author and very multi-talented healthcare professional. And I'm Bob Sobkowiak. I'm a registered respiratory therapist. Been doing this a long time, and just like to make myself available to help people with lung conditions. And at this point, I'd like to get started if we can. We're basically talking about the 7-step health action plan, which you'll understand more as we go along. But our COPD Breathe Strong patient education guide has evolved over the last 3 years. And this year in 2020, we've had 2 major changes. One, of course, the COVID-19 pandemic, and the other is the format in which we're delivering our information based on 7 steps that you'll be seeing. And with that in mind, we'll get started. And the next slide here, excuse me, talks about some common emotions in life with COPD that patients with COPD deal with. Loss, loss of function, loss of independence, feeling isolated, sometimes going through stages of anger and denial, depression, sadness, all these different emotions. But anxiety to breathe is a major one. And how can we cope is the question. We're going to be talking about that as we go through some of the refreshers from previous introduction to the action plan, but we're going to emphasize coping with COPD and other lung health conditions today. Jane, you want to talk about coping with COPD a little bit?
Sure. So, coping with COPD doesn't mean that you're giving up. It just means that you need to understand that you cannot control everything in your life. Sometimes it can be very overwhelming, but coping shows that you are ready to continue living your life and laugh whenever you can. Try to find humor in anything you can. What? Just a minute, excuse me.
I want to stop.
Okay, I have a friend, excuse me, she wants to talk. She showed up and I have to let her just say hello or she's going to drive me crazy all day.
Hi, my name's Esmeralda. Happy Halloween, everybody.
It's really nice to see you, Esmeralda. What was that other thing that you were going to say?
I'm not sure. Oh, yeah. Happy respiratory therapy to you guys.
Yes, it's National Respiratory Therapy Week. So I'm really glad that you could show up today, Esmeralda, and just, wish everybody a great year. It's been tough so far, but we're all hanging in there, right?
Yeah, we're going to do this.
Okay, now, Esmeralda, would you just go sit down in the chair now and be quiet for a while?
I suppose.
Excuse me, I have to help her sit down.
Shh.
Okay, now we're going to talk about coping with COPD. We're talking about laughter and humor and just trying to find the goodness in life because, a lot of us have our burdens and we suffer. And some of the best things we can ever do is just to reach out to other people and do something good for somebody else today. And it kind of helps take the attention away from yourself. You know, pick up the phone or Zoom with somebody and just tell a joke. You know, have some fun. This coping can be a time of reflection and renewal and a new plan of action for you. So check out the Breathe Strong 7-step action plan in conjunction with your doctor's treatment plan. This will help you cope. So coping with COPD. Well, we all have so many things we must cope with in our lives. And now you have this diagnosis of COPD, chronic obstructive pulmonary disease. And you've been probably shocked when you found out you had this diagnosis. COPD, well, what is it? You know, a lot of people go through a lot of emotions when they first get this diagnosis. They think it's like a death sentence, and it's not. You will feel a sense of loss maybe because you have shortness of breath and you feel isolation. You become less active. You go to a place of denial, and I'm not going to stop smoking because I really enjoy it. But you know, you're going to go through a lot of different emotions when you are diagnosed with something like COPD. It is not fun. It is not easy. You know, there's a fellow by the name of Nick who was diagnosed with COPD, and he had a second heart attack at the age of 56 years. And it was at that time that he finally decided, you know what, I'm going to quit smoking. And he turned his life around and he said, I'm going to not just keep focusing on myself, but I want to give back to my community and I want to help other people breathe easier. Bob, do you have anything you'd like to say about Nick? I know you knew him. He was a friend of yours.
Well, I'm going to go to the next slide and talk about him.
Okay.
Okay. We honor Nick Jones. You'll notice 1956, or at the age of 56 was when he was diagnosed. He lived 24 more years as a champion. And as Jane pointed out, it was at age 50, 6 years earlier, before that second heart attack, that he experienced his first heart attack. It wasn't until 7 years later that he made the commitment, and now I realize it is COPD. I've had a second heart attack. I need to stop smoking and really take charge. So that's one of the nice things I want to encourage you. The lessons that Nick taught was he might have denied things at first or not understood it as well, but he didn't give up. And then he took off. And he basically had decades of service where he started martial arts and Tai Chi for his community. He not only went on supplemental oxygen, his oxygenation needs increased, and he started a special group of a special type of oxygen delivery called transtracheal that helped patients get oxygen directly to their airways more directly for the patient who had higher oxygen needs. So he started a program not just for himself, because the company was based in Colorado. They started it in the villages for a statewide program. Jane's point about reaching out to others, Nick always did that. And the Airheads Village Support Group that he started in 2002, 18 years later, it's still going, okay, as a tribute to him and carrying it on. And for 19 years, actually 24, depending on how you calculate it, bottom line was Nick won the battle. His legacy is what we honor, and we consider him our father of Breathe Strong. And he basically had a can-do attitude. What can I do if I'm depressed or upset? I can go out and help someone. And that's what he decided to do. Now let's talk about the 7 steps of coping with COPD. Number 1 is gaining knowledge of your condition. Find ways that you can use the knowledge you have to help yourself. And know the signs of stress and how it will affect you. Use stress to motivate you and give you a sense of empowerment. You will need to change some of your lifelong habits, just like Nick did with the smoking. But bottom line is you're in charge, and that knowledge is powerful. Jane, you want to talk about that shortness of breath cycle that you might encounter as you go along through the journey?
Sure. I know we talked about this one time before when we were in this group, but I think it's important that we emphasize this. You know, you have that feeling of breathlessness, and so you want to do less because you don't want to feel breathless. And then your muscles start to weaken, and then you become more breathless. And then what happens? You start getting depression because you're not doing much. And then you avoid activities. You avoid any activity that makes you feel more breathless. So you feel more breathless and then you do less. And it's just this crazy, crazy vicious cycle. And, you know, it's up to you to just stop. You need to get a grip and say, I am not going to do this. And there are things that you can do to break that cycle. And one of them is taking charge. You know, you work with your healthcare team to get you back on the right track and get into rehab. We're going to talk about that later, but really that shortness of breath cycle is something that you need to grab a hold of and take it in a different direction. There are things that you can do. Next slide, please.
Now, the 7-step action plan, just a way of review. First thing is your breathing technique, breathing in through the nose and out through the mouth, but gaining control of, just like we talked about last time, the importance of making sure that you are in charge of your breathing. Your breathing's not in charge of you. You always want to coordinate that pursed-lip breathing in everything you do. You want to eat right for your lung health. You want to sleep well. You want to have an exercise plan, that 5-week walking plan that we talked about last week that's in our guide, just a gradual, especially if you're newly diagnosed or overcoming a flare-up, coming out of the hospital. You want to gradually increase in coordination of the medical direction of your physician or healthcare professional. Make sure that you're gradually increasing your exercise. You want to do it safely, but don't go backward, go forward. You want to make sure that you're following the tips of how to stay out of the hospital, finding the right healthcare team. Really important is finding your purpose. And then after all these 7 are integrated into your foundation plan, then the medications, especially cost, challenges or strategies for your needs, oxygen therapy if needed, all those other things can be added on as you go along for your specific needs. But that 7-step action plan for your lung health needs is going to help you design the plan for you. And it's based again on the 7 healers by Dr. Scott Kennard, we mentioned last week, last month, but the importance of just having the awareness of all these 7 steps of air and oxygen, water and food, sleep, play and exercise, your treatment plan, relationships, and purpose. But purpose and relationships is fundamental and vital. That it's different with everybody, but take the time to really just design your toolkit for your needs. And step here. Jane, you want to talk about putting them together here real quick?
Sure. So in the 7-step action plan, take control of your lungs today. You know, that's part of the whole coping process. I particularly want to focus on follow your action plan. That was number 5. That is part of the coping process, is being able to understand that you have an action plan and you know what to do. Should you start having anxiety and you're having a hard breathing day, you know, you will be able to cope a lot easier if you have a written action plan that you've designed together with your healthcare practitioner. So make sure that you have that at hand. Next slide. Okay, so Lori, are you there? Mallory, are you there? Okay, I'm not sure if you were with us last time, but we went over something called pursed lip breathing. And this can help open up your lungs and help you to relax. If you're having a hard time coping and you're just feeling anxious and you're short of breath, just immediately go to pursed lip breathing. You know what I say to everybody is you take your lips with you wherever you go. So you don't need any special equipment or anything like that. You can do pursed lip breathing in the grocery store or in your car or at the movies, anywhere. And most people probably won't even notice you're doing it. But what you do, I'm going to demonstrate here, is you take a slow, deep breath in through your nose and don't hold your breath, but don't breathe out too fast. And you're going to repeat this 4 or 5 times. You're going to blow out like you're blowing bubbles, not like you're blowing out a candle. Hang on one second. I have to rearrange myself. We did this little trick last time. I'm going to get, I'm close to the camera. Can you see me, Bob?
Yes.
Okay. So I've got this Kleenex tissue an arm's length in front of me. And if I'm doing this properly, pursed lip breathing, the tissue is going to flap in the breeze. And this is a good way for you to practice to know if you're doing it properly. So I'm going to show you first how to not do it, okay? It's not working. I'm clamping down too hard on my lips. Take a breath in now. This is how you do it properly. Put the tissue in front of you. Okay, it's a little bit hard on camera. Oh, she's doing it. Yes, yes. Very good. Just keep it an arm's length in front of you. Okay, excellent. Thanks for doing it.
Share something about that. That's great illustration. I just wanted to share with you a personal application of what you just shared. 2 days ago, I was up in Sarasota and pretty busy and getting kind of tired because I've had some recent heart problems in the past couple months, and I found myself short of breath, okay? And the way you did it the first time, Jane, where it was ineffective, that's what I naturally tended to do because I was scared.
Right.
I was anxious. It wasn't until I calmed myself down that I thought it through to calm myself down and control and remember how to do it properly. The reason I'm saying that is I've been doing this a long time, but any of us, if we get scared, can go right out of what we know to do right and allow fear or anxiety to get in the way. I'm only sharing that with you because I think that some other people may have that similar problem of whether my problem of a shortness of breath is heart or lung or both. We need to remember that when I'm anxious, I really need to remember exactly what you showed of how not to do it and how to do it.
Right. Also, one of the things I want to mention is, you know, if you count 1 for a breath in, and then on exhale, it should be 2, 3, 4. 1, 2, 3, 4. You want to increase the expiration time so it can actually help you to get rid of that trapped CO2, that old air in your lungs, and you will feel better. Next slide. Okay, so this is a very brief one. Breathing tips for catching your breath. You know, it's normal to hold your shoulders up like this. You ever notice when you're freaked out about something or you're really tense or, you know, you have your shoulders up, just drop them down. You know, do a few exercises like this, just to raise your shoulders up and then drop them and relax these muscles right here, okay? Stop that crazy activity that you're doing, whatever it is, and then rest and do your pursed lip breathing. I don't care if you're in the soap aisle at Publix, just do it. Lean against your cart and do the pursed lip breathing, and it will calm you down and you will get rid of that feeling of breathlessness. You know, then continue your activity and then do your pursed lip breathing as you go along. You can also use a pulse oximeter to check your heart rate and your oxygen saturation. Next slide.
Now, in addition, there's other tools out there to help and have fun at the same time. One's called the harmonica. The COPD 360 Music Harmonicas for Health program is available through the COPD Foundation. And they have groups. It started in Nashville, Tennessee with the music people, with relatives with lung disease. And that's how it kind of got started. And it's grown across the nation now to learn how to have better control of your breathing, exercise the muscles that help move the air in and out of the lungs, to strengthen those abdominal muscles. So, there you go, Jane. Thank you. I love that music. You are so multi-talented. And
I'm obnoxious too.
I tell you what, the next thing, I'll really freak out when you have Esmeralda play it. Excuse me. Oh, sorry about that.
Was
Anyway.
that Esmeralda calling you again?
That's Esmeralda calling me. You're right.
Told her to stop doing that.
Okay. Tell her I'll get back to her later. Okay.
We'll get back to you later.
Okay. So some of the benefits of the harmonica are decreased shortness of breath, increased sputum mobilization, increased quality of life. But I want to share with you the most important one I saw is the camaraderie that groups get. And it can be done by Zoom in the times we're in, I'm sure. Everything's being done by Zoom. But I encourage you to look at, you don't have to be musically talented. You just want to have an interest, to have another way to get together and help one another. It's a great program. I just want to mention it. And then, Jane, you want to talk about the breather?
Sure, sure. So Lori and Mallory, I know you're out there somewhere. I can't see you, but I know you're there. I don't know if you were, okay, hi. I don't know, were you on our call last time, Mallory? You were. So you probably saw this breather, but you know what? I'm going to tell you about it again.
Good.
So the breather is this handy dandy device. It can fit in your pocket, fit in your purse. And it is an item that we use with our patients to get them working with their respiratory muscles, their inspiratory and their expiratory respiratory muscles. And there are little dials on each side, one for inspiration and one for expiration. And they go up to 5. And the lower the number, the easier it is to breathe in and out. But if you have COPD, you may want to get one of these, get yourself in shape. And on expiration, you may want to increase the expiratory time because you may have air trapping, and it will be better to get all that air out by having a longer expiratory time. But watch me, I just want to show you how easy it is. Breath in, out. All right, so what you do is 10 reps, like I just showed you, and then rest for 2 minutes, and then do 2 more reps. And you should do this at least twice a day. So it strengthens your inspiratory and your expiratory muscles, promotes your diaphragm strength, and it generates improved airflow through the vocal cords. It also helps to reduce shortness of breath. Now, if you want to buy one of these, you can go to pnmedical.com. And if you put COPD Breathe Strong in the coupon code area, you will get 20% off. And I think the total price on that will run around $39, right, Bob? Something like that?
I think that's even before the extra 20%. It
Okay.
might be a little less than the 20%.
All right, but that's a good deal. And this really can help you build that inspiratory and expiratory strength that you need.
And as part of Respiratory Care Week, I must mention, this device was developed by a respiratory therapist in pulmonary rehab over 30 years ago in Orlando, Florida. So
That's
it's an
right.
RT device. Okay.
Next slide.
Okay. All righty. want to talk a little bit about diet, and because that's important too, is that if I'm going to cope with things, I need to make sure that I'm eating well. And different people have different needs. So this is talking about watching your weight in both directions. Because if I have a tendency to lean towards what we used to call the blue bloater or chronic bronchitis patient, I might be on the higher side of weight. I need to look at strategies to watch my caloric intake and input. Whereas the emphysema patient is what we would call classically the pink puffer, where I need to add calories. And I just wanted to make sure that you are aware of both ends of the spectrum, because basically if you take the big pie, 1/3 of people with COPD are in one group, another third are in another group, and then a mixed another third. So you want to tailor your dietary needs to your needs, but definitely it's important that you're sensitive to where you fit in your needs.
Hey, Bob.
Yes.
So the folks with emphysema, I've had this question thrown at me before, and it's like,
Sure.
why do I have to eat so much to gain any weight at all? You know,
Well, yeah.
Valerie or Lori, I don't know if those have ever come up for you, but think about how many calories you're burning just to breathe. You are working so hard sometimes. That's why you really need to have an increase in your protein, not so much the carbohydrates, but protein and fats in your diet. So
that's a really good point, Jane, because I think back of patients I've worked with over the years, and I remember two ladies in particular, one in each of those groups. And the emphysema person I remember was so thin that it was sort of like a pencil. I mean, a lot of times it's small meals, it's frequent throughout the day to really try to keep, not give up. And I always find fruits and vegetables very helpful throughout the day, because they always say an apple a day, but with this type of patient, it might be several apples a day throughout the day. But you want to make sure that you adjust, especially when you think of that emphysema patient. Many times they may definitely have a tendency of a lot of hyperinflation of their lungs that limits their expansion and how much they can take in at a time, as well as a difficulty breathing, because they require, as we talked about in the past, a lot more calories, and they have that deficit. So you want to keep that frequent small meal philosophy for those patients. Jane, you want to talk a little about the kitchen?
yeah, you need to clean up your act. You need to clean up your kitchen to breathe strong, okay? Make the most of every meal, and make breakfast your main meal if you can. And if you can eat 6 small meals a day, like Bob was saying, that's great, even if they're just healthy snacks. Make meals, of course, that you like. Invite somebody to eat with you, even if it's on Zoom, or pick up the phone and have a sandwich with your friend. You know, drink plenty of fluids throughout the day also. That's so important. If you're not on fluid restriction, make sure you're drinking plenty of fluids, and it actually helps to thin your mucus so that you're able to cough it out easier. And so, of course, remove foods if they give you gas or they actually push up on your belly. You know that feeling you have after Thanksgiving meal? You're like, I can't even breathe, I'm so full. And you know, I know that feeling because I do it every year. But things like pizza, hot dogs, cola, beer, cabbage, broccoli, onions, fried chicken, my absolute favorite thing. You know, those are things that you may want to cut out of your diet and put healthier foods in there that do not produce gas in your stomach. So, and also caffeine can interfere with your medications, and it can actually stimulate you more. And if you're already taking some medications that stimulate your heart somewhat, caffeine on top of that is not what you need. So be careful when you drink your caffeine, if you do, and the amount. Next slide.
Jane, can I make a comment on this slide?
Yes.
On the left-hand side there, where I'm really glad you mentioned about inviting someone to eat with. I think we have a real opportunity there that I wanted to mention, because as you make the meals that you like, invite someone to eat with you, eat slowly and plan the next meal, they all tie together. Because one of the things we have, I think we're losing in our culture a lot is conversation at a meal. And it gives you the opportunity to have a time where you can slow down, talk, listen to one another that helps you slow down. And I just want to take advantage of that opportunity because it might be a significant other, a child, a parent, that relationships that we talked about earlier can also be strengthened as you're working on your nutrition. Just wanted to mention that. Sleep. It's important, very much important. I'm learning this as I get older, the value of the quality of sleep, of getting that daily exercise, eating well, establishing that routine to go to sleep and wake up at the same time every day. Um, as a former respiratory therapist in the hospital, I worked a lot of night shifts, and it's really tough having varying schedules. And one of the things that if you can do is establish a routine as much as possible to get that quality sleep. Talk to your doctor about using oxygen therapy if your levels are low at night. If you need, you may want to make sure that you're just like exercise before an activity, you may need to take that medication before you go to sleep timely enough ahead of time, but to open up your airways beforehand. Get tested for sleep apnea if you have that daytime sleepiness. Consult with your doctor about the medications you're currently taking, and definitely avoiding smoking and limit your take of caffeine and alcohol. Jane, you want to talk about oxygen a little bit more there?
Sure. You know, I follow a COPD online support group. And one of the things that every day somebody is talking about is, why am I just so tired all the time? I'm just so sleepy all day. And, you know, some people aren't putting the pieces together, that they're not really resting at night. They go to bed and toss and turn and they're coughing and sitting up, but they're not getting that deep restorative sleep. And a lot of times people are having apnea issues, you know, upper airway obstruction, or they just have obstruction from the COPD and a lot of mucus that's sitting down in there. And they're just not getting a good deep sleep. So oxygen levels will drop and it will not allow you to go into that deep delta restorative sleep that we need. And that's part of our coping, is being able to have deep restful sleep. So, you know, if you suspect that you are not sleeping well at night, you know, try to find out why. And if you need to get a pulse oximetry overnight study done, that may, you know, uncover some of the reasons why you're not sleeping well at night. You know, you could be having apnea, or you could just have dips in your oxygen saturation at night. And you may need to have some nocturnal oxygen, maybe even just 1 liter, something simple like that. But Medicare does cover, and most insurances, they do cover sleep studies, but especially overnight oximetry. So if you have excessive daytime sleepiness, you know, address that. Check it out. Talk to your doctor about it.
Jane, I was going to ask you on this one. You and I have both worked in the past in home care. And one of the things I always found is that first time oxygen need of a patient many times is for a combination many times of during activity and exercise and or at sleep. Is that what you found also in your experience?
Yes, that is what I find in my experience. People, some people in the daytime are not even requiring oxygen, but then at nighttime they are requiring it. And then there's the opposite. There's people that during the daytime and they have activity and they're walking and everything, they need oxygen support, but when they sleep, they're perfectly fine. So that's not something you're going to really be able to figure out on your own unless you have a quantitative study done.
And that's why we used to always say in home care, make sure you're tested in all three settings, at rest, with exercise, and at sleep.
Definitely.
Now, speaking of exercise, you want to make sure that you have that walking routine, and you're using the breathing techniques we talked about earlier in conjunction with it, your pursed-lip breathing, that as I'm going, I'm blowing out as I go, but it's a gradual increase, and it's only a suggestion based on direction from your physician as far as how fast and how far. But bottom line, it's a gradual increase each week, increasing your level of walking, and using things like a pedometer or a watch these days with all the Apple Watches and the applications they have. Make sure that you have a way to monitor your progress in terms of both your oxygen level with a pulse oximetry, as well as a distance and steps, because you want to make sure that you have those goals, and they may change. Okay, it may be a situation where you take 3 steps forward and 2 steps backward, and sometimes have to adjust it, but in conjunction with your healthcare team. But the main thing is keep going forward, but sometimes the how far and how fast may vary depending on how you're doing. But you want to always be moving forward and have that minimal goal, but gradually increasing as you're progressing. And then also Tai Chi. With Breathe Strong, we're developing a relationship with the Tai Chi program, but in your community as well. Tai Chi is a great way to have an alternative way of exercise that improves your breathing, your heart function, blood pressure, balance, calmness, flexibility, that core activity, that energy. And we're also looking at adding lung health exercises that are conventional to pulmonary rehab, as well as Tai Chi, to our website very soon in the near future, with a respiratory therapist doing lung health exercises, and a patient who is an oxygen patient and Tai Chi expert on Saturdays. We'll be starting those in the next month or so. Just keep a lookout on our website, and we'll look forward to offering that support to you for at home. So both Tai Chi and lung health exercises will be available to you. And Jane, you want to talk about step number 5 again?
Sure. So it's pretty obvious. How can you tell if you're having a bad breathing day? Well, you're having shortness of breath and sometimes difficulty just completing simple activities like making your bed or doing the dishes or walking out to the mailbox. It's too hard. You're having more coughing, wheezing, mucus is thicker. You might even have trouble sleeping. You may even have a low-grade fever. So make sure you check your temperature if you're feeling that way. And sometimes you might just feel like you're catching a cold. Next slide.
So what are you going to do? If these are happening, if I'm having a bad breathing day and I want to stay out of the hospital, I need to do some things. I call these I wills, okay? I will check my activity and use my pursed-lip breathing. I'm going to make sure I'm taking my medications as prescribed. I will keep an eye on my temperature, and that's something you're doing every day anyway. I want to check my heart rate and oxygen level. I want to make sure if I need special medication attention, especially the rescue, am I getting the benefit? I'm in connection with my healthcare professional, and I'll call a friend and keep them in touch on how I'm doing. Jane, talk number 6, please.
Sure. I know we covered this last time, but we're going to cover it again briefly. And an effective care team can extend your life. You know, you need to have your total care team and your respiratory care team. And your total care team is like your primary doctor, your nurse practitioner, physician assistant, pharmacist, and a registered dietitian who can help you with your dietary needs. But a respiratory care team is comprised of your pulmonologist, your respiratory therapist, a lung health navigator, and possibly a psychiatrist and a psychologist. And, you know, it's so important that you reach out if you're experiencing having trouble coping and you're having anxiousness and depression, which comes hand in hand with COPD, call your psychologist or establish a counselor so that you can have somebody to share your thoughts and your feelings with to help dispel these horrible feelings that you can be having. Make sure you have a plan in place so that when the hard times hit, you're not just out there freaking out. Have your team as your family, people that you can count on. And part of your care team also is establishing friendships in your community or family members that can support you through the good times and the bad times.
One thing I want to mention too, on the patient side of things too, is that many times don't be afraid to take a real proactive role in connecting your healthcare team members. Don't assume that your electronic file system of information is taking care of everything for you, because technology and computers are only as good as the information put in. And many times one provider, like a specialist in a primary care, even though they're in the same healthcare system, may or may not be seeing the same information you as the patient know. So be proactive in dialoguing, advocating for yourself to make sure all the communication is getting across. And have your checklist, things you need to ask your doctor. I'm sorry, Jane, you want to address this one? I'm sorry.
Sure. I'm just going to run through this one very briefly, and then we're going to wrap things up. But have your doctor checklist. You know, ask if you're eligible for pulmonary rehab or tele-rehab at home, which you probably are. You can even get that for a very low cost if you don't have insurance. Ask about your medications that you should take before exercise. Ask about the amount of steps a day that you should be walking. Ask about the triggers, irritants, things that make your COPD worse and how to deal with them. Ask about upcoming travel plans with your doctor. Ask about rescue inhalers. You know, understand your medications. If you don't know what they do and when to take them, make sure you ask. You can ask if there's any clinical trials available. It could help get you involved with other people. You can go to the COPDfoundation.org or pulmonarytrials.org or COPDbreathestrong.org for more information on those. But you should do the following at least once a year. Check with your doctor about a spirometry test. I'm sure you've all had pulmonary functions or at least spirometry done. It should be done annually. Discuss any of your educational needs. Have a complete physical exam. Review and update step 5 of your action plan. Make sure you have your action plan. And ask your healthcare practitioner about the flu shot and the pneumonia vaccine. And what's the other one, Bob? Shingles.
Yep. And also make sure that you ask about the DPT as well.
Oh yes, pertussis.
Okay. Let's talk about purpose. Last one, number 7. We mentioned it last week, but I just want to mention it again. I'm not convinced that your date of death is the date carved. Bottom line is, have something purposeful to live for. And that purpose is so important. And a great illustration of that purpose is our friend Karen, our patient advisor. Jane mentioned clinical trials. Recently, Karen was on a task force that she's giving input to government and health insurance researchers on clinical trials for medications and effectiveness of the newest medications. She's doing that because over the years, she's become more and more involved with helping herself help others. And I just wanted to let you know that that starting point we had at the beginning of taking charge, this is just like the flip side of Nick is Karen, is that over the years, for over 29 years now, she has taken charge and making sure that she's winning the battle, not only for herself, but championing for others. Just want to encourage you with that. And with that in mind, let's take it back to questions and answers. Back to Angie.
Excellent. Well, thank you guys. There's a lot of information, and you guys do such a good job of telling your stories and kind of relating to the experiences you guys have gone through. For the participants on the call, do you have any questions or have any stories or experiences you want to share?
Lori and Mallory, can you unmute yourself so we can?
Yes.
Great.
I have a question. Lori here.
Hi.
And I just want to thank you both. This was a super wonderful presentation, and I learned many new things. How do you draw the line, or is there a line in COPD between emphysema and COPD, or is emphysema just a part of the overall disease?
Who's going to take that one?
I'd be glad to try to initially tackle it. It's an umbrella term.
That's a very good question.
It is, because it has changed definitions in and out over the years. But the current thinking, I believe, is still pretty much of chronic obstructive pulmonary disease represents a chronic condition with obstruction of the airways that are most commonly caused, especially in North America, by chronic bronchitis, which is that chronic inflammation of the airways and sputum production, versus emphysema, which is the destruction of the air sacs. Many times those can go hand in hand, and I may have a mixture of those two conditions. The third overlap is what we call refractory asthma, which is a chronic form of asthma that is severe in controlling the asthma. It's more of the chronic inflammation aspect of the airways. Those three are the classic three, but emphysema is a component of the umbrella. And a good example is that anybody with asthma or COPD is advised to have a test called alpha-1, which is a test that used to be a blood sample, but now can be just a swab in the cheek sample to see if I have the genetic form of emphysema, the destruction of the airways due to a lack of a certain protein in your blood. The reason I mentioned that example is that alpha-1 is an example of emphysema, not necessarily COPD, considering chronic bronchitis as well. But they're all overlapping, is my point.
Very good question.
Thank you.
Did that help? I'm not sure if I confused things.
Yes, it did. It did. It definitely did.
Oh, I have a question.
Yes.
Oh, yes. Does anybody know what we call a Jewish grandfather in Hebrew?
A Jewish grandfather?
Yeah. Does anybody know that?
No.
It's called a Saba.
A Saba.
Saba. Yeah. Grandmother is Safta. I'm a Safta. But a Jewish grandfather is a Saba. But there's another definition for a Saba. The first person to tell me what a Saba is going to win a free book, and I'm going to send it to you. It's called Abracadabra. What's a Saba when it comes to breathing?
Can we give them a hint? Short acting.
Yes, yes. Come on, guys. Look it up.
Google it.
You can Google it. I'm not looking.
It's something you use when you're doing a rescue and healing.
Yeah.
Short airway.
Saba. and there's laba, and there's llama, and there's it, and there's ox. And you probably think I'm all crazy, and I am. These are just some of the different types of meds that you will be seeing, but a SABA is one of them. Okay, well, I think Angie, I think you were starting to answer it, so.
Well, I don't want to answer it. I want them to, because I want them to get the free book.
Okay.
You win. Short airway, something.
Bronchial.
Let me try to
Yeah.
help.
Close. Yep.
Were
You're
the
on
two
track.
ladies on the call here last time? Oh, no, we really didn't get into the medications. Oh, shoot.
I think somebody just said bronchial, broncho.
Short acting bronchial. What's the last day? I don't know.
Agonist. Forget that word. But yes, you won. Ding, 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 ding. So we're going to have to, Angie, can you get her address for me?
Yep,
And
I
phone
will.
name? And Esmeralda wants you to have her book. And
And
make
that-
sure if you know anybody, especially a little kid that has asthma, you may want to share the book with them. Asthma Cadabra is also available on Amazon.com if you want to order one. But yeah, short acting beta agonists, like some examples would be Zopinex, albuterol, Provento, Ventolin. You've heard those names before, right?
Yeah.
These are the rescue drugs. This is the one that we take when we're having shortness of breath and we need something right now. Short acting beta agonist. SABA. Next time we're going to talk about a LABA. Right,
And
Bob?
if you're reaching out for that SABA with the inhaler, try to make sure you have a spacer with it as well.
That's right. And you can think of your Jewish grandfather.
I like that.
Well, I certainly had a good time today. How about you?
Yeah, it was a lot of fun. Next month, we're going to be talking about nutrition and healthy living. We may incorporate a couple things with like meditation and maybe some yoga just to kind of switch it up a little bit. And then make it a little bit more interactive. So you guys feel free to invite your friends, family, and definitely you can reach out to me with any suggestions on how to make this better for everyone. Because I definitely want to bring more people in because I think it's so important to connect. Because COPD, you know, you tend to want to stay inside a lot and they're very cautious with activity, especially if, you know, you're having a lot of flare-ups. So this is so important to keep connected with others and engage, even if
You
that
are
means
not
from your
alone.
home.
You are not alone.
Yeah, exactly.
I have
And the interesting thing that you guys were mentioning about the breathing, what I've noticed with a lot of patients, they say that, you know, they're focused on the task, on the activity, like getting up, going to the bathroom, going to the grocery store. So they forget to breathe when they're in the momentum of doing that. So I always tell them to be mindful and just with each step, take those breaths. It's so important because you get so focused on, I got to get this done. I got, you know, and you don't stop to really, you know, take those breaths. And then by the time you're done, you have to really struggle to get caught up and to compensate. So I thought that was interesting. And I also want to mention that our support groups will be on YouTube. If you go to smh.com on the blogs or the Facebook, it'll have a link to YouTube videos and you just have to put COPD in and it'll bring the videos up. So we're going to, and I can send the link out to everyone as well.